Welcome. In this video, we'll talk about options for managing pain after your upcoming thoracic surgery. Treating pain is an important part of the recovery process. When pain isn't well controlled, it can become harder to take full, deep breaths, which can increase your risk of complications and slow down the healing process. You'll likely feel two main types of pain after thoracic surgery. The first type of pain is incisional pain. This is where your surgeon has made cuts in the skin. The second type of pain is chest tube pain. This often feels like discomfort in your shoulder or back, which will go away once your chest tube is removed. To manage your pain effectively, your anesthesia team may use a combination of treatments. One approach is a nerve block, where numbing medicine is injected to block the chest wall nerves. This reduces pain signals, making it easier to breathe deeply and recover more comfortably, often with less need for strong pain medications. You may be offered a paravertebral nerve block. This is placed by an anesthesia provider before surgery while you're still awake. You'll either sit up or lie on your stomach. The area on your back is cleaned with an antiseptic solution. Freezing medicine is injected into the skin to numb the area, and then a small needle is guided with ultrasound to inject numbing medicine near the nerves. Risks are rare, but can include bruising, infection, or very rarely, lung collapse or nerve damage. Your team will monitor you closely to keep you safe and comfortable. This block typically provides incisional pain relief for 12 to 24 hours. If you'd prefer not to have a nerve block while awake, your surgeon will place one while you're asleep during surgery. This is called an intercostal nerve block, where numbing medicine is injected along the ribs under direct vision. It's also very effective for incisional pain, but typically lasts about 6 to 12 hours, a bit less than the paravertebral block. Regardless of nerve block technique, it is important to start taking pain medications either by mouth or using your IV once the freezing starts to wear off and you start to become more aware of pain, ideally before the block has worn off completely. If you're having a bigger surgery like a thoracotomy, an epidural is often the most effective option. This is placed by your anesthesia provider before you go to sleep. You will be asked to sit on the bed in the operating room in a slouched position. Your anesthesia provider will identify the appropriate site, apply an antiseptic solution, and then they will freeze your skin with a small needle to ensure your comfort during the procedure. After locating the epidural space with a different needle, a small tube, or catheter will be left in place and will stay there for several days to provide continuous pain relief. An epidural reduces pain, decreases the need for strong pain medications, lowers your risk of lung infections, blood clots in your legs, and sluggish bowels, and overall helps you move around sooner. Risks are rare but include bleeding, infection, nerve damage, headache, itching, and low blood pressure. In some cases, the epidural does not work as well as we would hope, and we may have to adjust or replace it after your surgery. Your anesthesia team will monitor you closely to ensure you have good pain control after surgery. Regardless of whether you have a nerve block or epidural, your anesthesia provider will give you pain medicine using your IV before you wake up. These medications will treat both incision pain and chest tube pain. They will use medications from different families to maximize pain control while minimizing side effects. Your anesthesia provider will work with you to decide what's best for your surgery, because staying on top of pain helps you breathe better, move sooner, and heal faster. If you have any questions, please discuss with your anesthesiologist on the day of surgery. Thank you for listening. We wish you a smooth recovery.